Joining us now is Dr. Morris Papernick, who works to educate health practitioners as well as the public about chronic fatigue syndrome and fibromyalgia. Also joining us is Jane Barber, who is living with chronic fatigue syndrome. Welcome, both of you. I'm glad you came.
Thank you. Welcome to the show.
Thank you
Thanks
so much for
us.
coming and
Thanks for having
sharing
me.
with
it's
us.
A pleasure.
This is a problem that is, I think, either becoming more and more prevalent, or else at least the Center for Disease Control is talking about it more. What is the case? What's the situation?
Well, I think the situation is that we are all learning more about the illness. As we learn more about the illness, we learn more about how to diagnose it and how to treat it. We're seeing more and more patients becoming diagnosed with it. As you guys mentioned before, right now 1 million people have chronic fatigue syndrome, but 80% of them are not diagnosed out there who already have it. So the importance is to get the word out, to get the education out, not just to the lay people, but also to the physicians, the healthcare professionals, so that they understand the illness better, so they can better help diagnose and treat these patients.
If we estimate 1 million people with 20% diagnosed, when you have a number like 80% being undiagnosed, the odds are that number is probably really higher than 1 million, isn't it?
Sure. We estimate it's probably about 4 to 6 million people.
Yeah, because anytime the lion's share of your data leads to that side, then that side's bound to be even larger than it is.
Right.
Maybe some of our viewers have maybe heard this, and I want to know if some of these guidelines have changed. I'll just give a brief history here. In 1986, I was diagnosed with CFS before it was popular at all, and that was back then seen as this thing with the Epstein-Barr virus. What are the credentials, if you will, or qualifications
criteria
you have to be said, okay, you have chronic fatigue, it's not these other things?
Well, the criteria, as we know now, based on definitions that we have now, basically, you have to have fatigue that's been there for at least 6 months, hence it's chronic. You have to have the fatigue that's debilitating at least 50% of your life. In other words, it impacts 50% of your life. And there is no other illness that's causing it. So you rule out all of the possibilities. You rule out diabetes, you rule out chronic kidney disease, liver disease, hypothyroidism, anemia, vitamin deficiency, mineral deficiency, neurological diseases, MS, and things like that. And once you go through the whole litany of testing, you're left with 3 diseases basically which have the same symptoms with no real blood test, if you will, to say that they have the disease. And they are chronic fatigue syndrome, fibromyalgia, and depression.
What portion of your life was debilitated before you sought help?
I would say 70% of it, because I thought I'd been just working a lot of hours and that I would just get better, and I was just burned out, or maybe I just needed a vacation. And my onset of the illness became clear really 18 months after I'd had a major jaw surgery. And I'd been struggling with the fatigue and a gradual loss of functionality over that time, but anybody that loves their profession, the tendency is to just push past. You get up and you go, you have a deadline, you've got a client meeting, you just white knuckle your way through it. And then I started noticing that I wasn't, and I thought, because I had the jaw surgery, I thought, well, maybe it's just taking me longer to heal.
I would have thought the same thing.
And I just keep, I'm still triathlon training, and I'm still trying. Then I noticed I couldn't exercise, and then I noticed I was getting up at 9, doing a couple hours of work, going back to bed at 11, taking a nap till 3, starting to call clients back at 5, and then being exhausted by 6, and it still didn't sink in. So what really hit me was when I tried to take a trip to New York. I did take a trip to New York that I had frequently taken about the same time of year to go see the same trade show. And when I had that 5-day trip, I noticed that I couldn't do as much in a day. I was getting sick from the chemicals at the furniture show. I was having profound levels of body pain and this incapacitating profound level of fatigue that I had just never experienced before I had this surgery. I mean, anybody that knows me knows that, if I had to work a 16-hour day, I worked a 16-hour day.
Doctor, do you think that her fatigue could have had anything to do with her surgery?
Definitely any sort of traumatic experience can precipitate something like this. Usually we think right now chronic fatigue syndrome is viral in origin. However, we do hear stories that are very similar to hers in that after some sort of traumatic event, whether it be surgery, sometimes a motor vehicle accident, a psychological trauma, can also precipitate something like this.
But you don't feel then, based on your answer, that the jaw surgery, perhaps a medicine that she was given or a shot she was given could have caused some type of mercury toxicity or metal toxicity? Do you see that? Do you test for that in your CFS patients?
No, we used to do things like that and test for things like that, but lately the data does not support doing that anymore. Okay. That's one of the things that we have looked at in the past, testing for a lot of different things, testing for Lyme disease, testing for HIV, testing for TB, things like that that could be the cause for some of these patients with fatigue. But the statistics don't bear it out, that testing for these things, the yield is quite low. And so the likelihood is low that we're going to find the answer there, unless the patient's either behavior patterns or where they live might suggest that. So if you live in Lyme, Connecticut, Lyme test might be a good idea. Okay.
Yeah.
All right, well then that being the case, let me ask you this. I see in our statistics here that females, incidence is higher among females. Why do you think that is, and what physiological component do you see in patients? I mean, do you see an elevated titers to any particular antibody? Is there tissue inflammation? Is there any commonalities in a physiological way that you see in a clinical sense?
And that's part of the problem with this illness, is that we don't have a biological marker for this illness. So there are no inflammatory markers, there are no blood tests which say you have chronic fatigue syndrome. That's what makes it so difficult. We have guidelines that suggest that this is what the answer is, but basically, as you said before, this is a diagnosis of exclusion. We make sure you don't have anything else that's causing it. Why do women seem to have a preponderance of this illness versus men? Don't really know the answer to that question. There could be a genetic basis for that. There could be just a statistical basis for that more women go to the doctor than men go to the doctor. More men are less likely to admit that they have the illness, they have the significant fatigue. Women are more in touch with their bodies, and they're more in touch with their illnesses, and they're more likely to go seek help.
Well, when you say, now, is fibromyalgia and chronic fatigue syndrome, is the fibromyalgia often a cause of that? Because I know fibromyalgia is certainly a higher incidence in females as well. Does one have anything to do with the other? Do you see one coming after the other more commonly?
There are two schools of thought on that. One is that they're two separate illnesses. The other is that they're both the same disease with different manifestations on a timeline, so to speak. So the fibromyalgia patient has more pain and some fatigue. The chronic fatigue patient has more fatigue and some pain. Okay. There are people who have both. Whether or not they're the same disease, we don't know that for sure yet.
Jane, could you describe some of your physical symptoms when you were going through the process of being diagnosed, besides the fatigue?
Well, initially, when I went through my first diagnosis, 18 months after I had the jaw surgery, I had thought I had titanium screws put in my jaw. That's what I believed. And I went in to see a doctor because I was getting so sick from the chemistry that I had to work with. So I was initially diagnosed with multiple chemical sensitivities, but I had the profound incapacitating fatigue, chronic sore throat, swollen glands, muscle skeletal pain, unrefreshing sleep. No amount of rest ever made me feel rested. And that was puzzling to me because I just could not do it. The way I would describe, there's that good kind of tired when you're well and you work out and you come back from a bike ride, if we all remember when that was, and that's a good kind of tired. I wasn't having that kind of tired. I was having the kind of tired where if I was in the grocery store, I would have to stop and sit down in the aisle. Then I'm going, something's wrong here. Yes. So I went to the doctor, and I wasn't initially diagnosed with chronic fatigue syndrome. So the frustration was I wasn't able to get that, even though, ironically enough, you talk about viral illness. I had a viral illness when I came back from New York, and it lasted over 6 months. It was a flu, and I could never get rid of it. I could
That's
never
how it was for me.
shake
Immune
it.
system was
So what
just-
happened was the alloy that was put in my jaw, I later found out that the alloy that had been put in my jaw was actually had something called nickel chloride 2.